Hey everyone, today we are gonna discuss all the key facts of hemophilia, and please don't forget to jot down the important points of hemophilia, which is extremely high yield topic. As you all know, that hemophilia is one of the most common inherited clotting disorder deficiency. So there is a clotting factor deficiency in hemophilia. There are different types of hemophilia, and the most common type is hemophilia A, which almost accounts for 80% of hemophilias. So here there is a reduced amount or activity of factor 8. So factor 8 deficiency is there, and it is one of the commonest disorder. And apart from von Willebrand disorder, which is a very common bleeding disorder, this also is a very common disorder. Here there is a specific factor 8 reduced level or activity that is being seen. So hemophilia A, how does it present as? So this is the hemophilia A, which is very common. What are the other type of hemophilia? There is hemophilia B, which is the factor 9 deficiency. So hemophilia B, there is a factor B deficiency, and even there is a hemophilia C. There is a hemophilia C. Hemophilia B is factor 8. Hemophilia C is factor 11. This is exceedingly rare hemophilia C. Hemophilia B almost like 20%, and hemophilia A, if you say, it is almost like 80%. So 80, 20, and almost like less than 1% is accounted by hemophilia C. So that is the important thing that you should remember, and all of them are X-linked recessive disorders. So X-linked recessive disorders are there, and so it is much more common in males. Clinical features are more commonly obvious in males, whereas females, it may be there, but generally it acts as recessive. So important thing, it is more commonly seen in males. Males are the patients, and females are the carriers that you need to remember, that is commonly being asked. So clinical features. So clinical features depend upon the severity of the disorder. How much is the severity, and the severity itself depends upon the level of factor 8, factor 9, or factor 11, whatever it is. So coming to factor 8 level, if it is less than 1% of the normal factor, so less than 1% will signify a severe deficiency, and it is called as active disorder. So less than 1% is active or severely reactive disorder, whereas activity 1 to 5% is called as moderate hemophilia. Whereas if factor 8 is 5 to 50% of the normal, then it is called as mild hemophilia. So severe hemophilia, moderate hemophilia, and mild hemophilia, less than 1%, 5 to 50%, and more than 50%, that is hemophilia. Mild, moderate, and severe, how it is classified as. So predominantly affects males. And clinical features. What are going to be the clinical features of hemophilias? So hemophilias, atypically with the severe disorders, it generally presents immediately after birth, within few hours after birth, and that is the typical manifestation of severe disorder. Mild to moderate may present a few hours or few days later, and newborns may have some bleeding problems, and there may be difficulty in the circumcision, or in bleeding, excessive bleeding may be there, or separation of umbilical cord may also lead to severe bleeding. Massive hemorrhage is seen after trauma or operative procedures. That is a common finding. And one of the important clinical feature is spontaneous hemorrhage into the joints. That is known as hemarthrosis. Not only joints, like large joints like elbow joints or knee joints are affected, but also soft tissue hematomas are very commonly obvious. Generally, petechiae or pinpoint bleeding, which are the feature of platelet disorders, are not being seen over here. So petechiae are seen in platelet disorders. And here you may also see epistaxis sometimes. Epistaxis also may be noted in some cases, but Generally, a large joint bleeding or hematoma into the soft tissue, these are the more obvious clinical feature. Even some cases, dental tooth extraction may lead to severe bleeding, and operative procedures also may lead to severe and delayed bleeding may also occur. So here you can see the massive cutaneous bleeding in this patient, and also here you can see the large joint hematoma that has occurred due to this hemophilia A. And management. Now, how do we manage? And first of all, before managing, before treating, we need to diagnose it. So how do we diagnose? So we do all those tests, like platelet count will be normal, and bleeding time will be normal, because bleeding time is a manifestation of blood vessel integrity, and the platelet count and function, that will be normal. Here, factor 8 is an intrinsic, it is involved in the intrinsic pathway. So, prothrombin time will be normal, and which is a marker of extrinsic pathway, and intrinsic pathway marker, that is prothromboplastin time, or we also call it as activated partial thromboplastin time. So, partial thromboplastin time or activated partial thromboplastin time, these will be prolonged. So, increased APTT or PTT will be seen. That is the key feature of hemophilia, and all other tests are normal. And after we get this prolonged APTT, PTT, we may do a kind of a mixing studies. We call it as a mixing study, where we where 50% of the patient's plasma is being mixed with the 50% of the normal control. If it is normal after that, if the result is APTT is normal after the mixing of the samples, then we go for factor 8. If the mixing studies are after the mixing of the sample, still it is abnormal, result is abnormal, then you may conclude that some kind of a antibodies are there against the factor 8, that is inhibiting the factor 8 activity. So if mixing after mixing test, if the results are normal, mixing of the sample results are normal, then you may do factor A. Particularly, you may do some factor concentration assays, factor assays you may do, like you will do factor 8, and factor 9, factor 10 you will do. So in case of hemophilia A, you will be having factor 8 activity will be severely affected. It may be severe, it may be moderate or mild in some cases. Majority of the cases, they present with moderate to severe activity, severe activity deficiency. So moderate to severe hemophilia is commonly seen in these cases. So what will happen after that? After you diagnose the hemophilia A, then you have to treat. So treatment is mild disease if the it is activity is it's just it's 5 to 50% of the normal, then it is mild hemophilia. Then what you will do, you can treat it with desmopressin acetate. Desmopressin acetate, it is a synthetic analog of ADH, antidiuretic hormone, or vasopressin. So what it does, it increases the release of factor 8 from endothelium. That is the function of this desmopressin, a synthetic analog of vasopressin or ADH. In severe cases, moderate to severe cases, you may give directly factor 8 transfusion, recombinant factor 8 may be given, or even cryoprecipitates may also be given to manage these severe cases of hemophilia. Hemophilia B is due to uh, factor 9 deficiency, and it is again a X-linked recessive disorder. Clinically, the features are the same as that of hemophilia A. Lab findings are the same to hemophilia A, with a decreased factor 9 level will be seen, and more typically, there will be increased APTT will be seen. Factor 9 will be deficient to differentiate it from hemophilia A. So this is how hemophilia B is being diagnosed, and the treatment modality will also involve the same. You will basically give, in severe cases, you will give factor 9 concentrate will be given, and cryoprecipitate may also be given. And hemophilia C, as we mentioned, it is extremely rare. It is the deficiency of factor 11, which will always almost same having the same clinical and lab features as that of hemophilia A and B. So that's all about hemophilia A, B, and hemophilia C. So hemophilia, let's capture the key facts that we learned today. Hemophilia A is more common. Hemophilia B is 20%. Hemophilia C is less than 1%, and they involve the deficiency of factor 8, factor 9, or factor 11. Factor 8 deficiency is known as hemophilia A, and severe hemophilia A means activity of factor 8 should be less than 1%. And here you will see in all the cases of hemophilia, you will get bleeding into the large joints, and there will be a delayed bleeding in the tooth extraction, and there may be even epistaxis as well. All will have increased APTT, and you will have uh, decreased factor levels in hemophilia A and B and C, respectively, of factor 8, factor 9, and factor 11. And you have to manage it by giving either desmopressin to release of, especially in hemophilia A, you have to give desmopressin. And in the mild cases, you may give desmopressin to release the factor 8 from endothelium. In other cases, in severe cases of hemophilia A, B, and C, you have to give specific factor concentrates or cryoprecipitate. Thank you for patient hearing, and hope you like the video. Please like, share, and subscribe, and comment in the video regarding your any kind of queries regarding hemophilia. We'll see you in the next video very soon. Bye bye, and take care and happy learning. Thank you.